Welcome, everybody, to the Homegrown Heart Podcast with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist and expert in her field. And this week's topic is, well, just who is Dr. Amanda Ryan? Well, here she is, folks. Please welcome your host, Dr. Amanda Ryan.
Good morning. It's July 12th, 2024 here in beautiful Carlsbad, New Mexico, and launching something that I'm passionate about that I've been working on for several years called the Homegrown Heart. It's going to be a weekly podcast talking about all different topics in healthcare, particularly cardiovascular health, wellness, the challenges of being a female physician, the specific challenges of rural healthcare, the uniqueness of our area here in Carlsbad, New Mexico. It is a very enriched, unique area, and learning how to practice medicine and really trying to benefit our patient population from a community health standpoint to the best of our ability has provided a lot of challenges in the last 9 years, also provided a lot of opportunity for growth. And my goal of today is to kind of introduce you to different things we'll be discussing and how we got where we are. So again, the name of our podcast is My Homegrown Heart, and that is a fair title. I get asked a lot, how did I get where I'm at in healthcare or in life in general? My mother had me as a teenager, and she's always like, why do you have to tell that part of the story? Because it's relevant. She really made the choice to step up and be a parent when she was completely overwhelmed. She was a very bright young student herself. She grew up in a small town. Parents had been from a Depression era, and going to college wasn't really even discussed where I grew up or in my mom's household. It was relatively normal that you got married, got pregnant relatively young, and most women stayed at home and most men went to work in the local factory, and that was considered what was a normal life. And there's certainly nothing wrong with that. But sometimes we have, young people have a desire to kind of break out of the mold and try something different. Over the years, I've had a lot of, and I'll jump around a lot because I'm not somebody that really needs a script at this point. I like to just kind of talk off the cuff. And so if sometimes you're like, wait, where is she going? My husband does that sometimes too. Like, wait a minute, where did we go from A to B? So sometimes I will jump around a little bit. So bear with me on that. There's a lot of different things I want to discuss and that I think are important to my story and to the real story of rural healthcare. This is not a podcast just about Amanda Ryan. However, I'm thrilled to share myself and my vision with you, something vulnerable about really opening up about your family, your practice, your passion in healthcare. And I'm really looking forward to the input and the positive and the negative input. That's how we improve. I'm a woman that trained in a primarily male-dominated specialty. These are approximate numbers, but there's about 6,000 interventional cardiologists in the country. There are 200 women. So I do tell my husband that I'm elite. I don't know what he thinks. We'll have him on at one point to give his opinion on that. No, but definitely being in such a male-dominated specialty that's difficult, procedure-based. We do procedures, and we'll have time to talk about what we do in interventional cardiology over the next several weeks. But it is definitely a challenge and a way that has to be approached in a certain manner. So back to my mom to close that story a little bit, although she'll be a recurrent theme throughout this podcast too, because she is an amazing inspiration, as are my grandparents, aunts, uncles. I can't tell you how amazing the upbringing that I had really was. And I see that more and more every day in the challenges that many people have, how important and really fortunate I was to have the background that I did. So again, my mom did have me young, and she kind of struggled to figure out what she was going to do. She actually worked as a CNA. She went to high school her junior and senior year from 7 in the morning until 1 in the afternoon. She got off and she worked from 2 to 10 as a CNA at a local nursing home for about $2.10 an hour. And then she would be up with me all night. She moved in, her and my father, with my aunt and uncle, who were also young parents. I think they were 20 and 19. They had two young siblings, and so they were pretty much, my cousins are like my sisters. We were 3, 2, and 1 stair steps. My aunt, uncle, and my mother rotated working, going to school, eventually all going to college, getting degrees, and with very minimal assistance. A lot of love and some support from that end from our grandparents, but basically they were on their own financially as well as babysitter-wise. So when I think what they really sacrificed so that we could have all the opportunities in the world, it's pretty amazing. My mom became a nurse. She actually became a CNO, a COO of major companies managing long-term care facilities and rehab facilities all over the country. At one point she worked for Manor Care, which again was a very large, owned over 500 facilities nationwide. She worked for several different organizations out on the East Coast. So again, when I got Advanced Heart and Vascular Center of New Mexico and Advanced Ambulatory Surgery Center of Carlsbad, New Mexico, which we'll talk about those practices at some point here too. When I got those going, of course, I asked my mom to, semi-retire, quote unquote, and come out here and help me launch those practices, which she has. And as a 40-year experienced nurse with just a vast amount of training and interaction with so many different patients and healthcare professionals, business professionals over the years, she's brought a wealth of knowledge to the experience. So that's really been great. So that's to say my mom is an amazing person and has a lot to do with why I'm here. And again, remember the point of today's podcast is really how we got where we are. Like, why are we here and what are we doing? My grandfather also has a lot to do with it. He is the reason I am a cardiologist. My grandfather had his first heart attack. I think he was about 36 years old. He was a hardworking construction man. He was building bridges, concrete finishing, which I think when you ask people who've done a lot of different manual labor, concrete work is very physically taxing. It was not uncommon to drive around with my grandfather as a child and have him say, well, I helped work on that bridge and I helped work on that bridge. That was in Southern Illinois, about an hour and a half from St. Louis and about 3 hours south of Chicago. And so with that, about age 36, he started developing a lot of left shoulder pain one day at his job. And years later, he would tell, I wasn't alive then, of course, yet, but years later, he would tell me the story. And, he said, swinging jackhammers and all kinds of different equipment, sledges. And he said, he didn't really, it was intense left arm pain, but he really thought it was musculoskeletal. I mean, he didn't know any better. Turns out that was his first of many very large heart attacks. However, he could have went and sought care, I'll be honest. At that time, the treatment was pretty much put you in the ICU and give you aspirin, and you either lived or you died. So it was kind of self-selection back then of when you think about what we have as options now, it's not uncommon for a patient to come in to the emergency room having an acute heart attack, 100% blocked artery. We get that artery open within 45 minutes and we go through their wrist to get to their heart artery. And they may say, can I go home? 30 minutes later, they feel totally fine. It is just, when people ask me that, again, a little jumping around, what made you want to be an interventional cardiologist? And as I started the story, my grandfather was my initial motivation. But the chance to, the decision to really choose interventional, which is, again, the part of cardiology where you're really going to do the procedures. You're going to open people's heart arteries when they're having heart attacks. You're going to work on their leg blockages. You're going to work on veins in their legs. You may even treat carotid arteries in the neck, aneurysms of the abdominal aorta, in the abdomen. All these different, what makes you want to do that? What makes you want to get out of bed at 2 o'clock in the morning? And it is the chance to have immediate gratification, it really is life or death when somebody comes in having an acute heart attack. And the way that you feel when somebody is literally, they're on death's door, oftentimes, and the ability to change their life that quickly. And again, I facilitate God's will. People ask, how do you take all the responsibility? How do you cope when your outcome is not the outcome that you would have hoped for? And that's definitely a challenge for all of us in medicine. But I always say, I don't take all the glory nor all the responsibility. I do see myself as a well-trained facilitator of God's will, and sometimes no matter everything I do or everything I don't do, the outcome is what the outcome is going to be. So I do my very best to remain calm. I have an extremely well-qualified team that works with me, and we do our best to remain calm and make a difference in as many lives as we can, which we've been very successful at out here over the last 9 years as well. So, back to my grandfather with the heart attack in his 30s. By the time I was born, his pump of his heart, which a normal ejection fraction should be about 50 to 55%. That means you pump half the blood out of your heart's arteries every time that it beats. Okay, so my grandfather's pumped at about 10%. And really, when it's 10% or less, it's hard to even, it's 5, it's 8, it's 10, it's just not good. Anything less than 35% actually is at risk for sudden cardiac death, and actually we recommend those patients get a defibrillator, which is a special kind of pacemaker. So again, all these ideas can be developed more thoroughly and explained better as we move forward. But important to know that, probably his ejection fraction had been that low for many years. And he kind of survived on just, I used to say, sheer meanness and stubbornness that kind of got him through. He wore his oxygen. He traveled around and did the best that he could. He worked until probably about the age of 60. And looking back, I don't really know how he managed to do that. But he was just, born of a different stock and built in a way that that's what you did. You provided for your family, and that's what he was going to do. I will say from the day he kind of stopped working, the challenges got, even more dramatic in his life as far as health went. So my grandfather, again, with this heart condition, would frequently be admitted to the hospital, had a hard time finding quality care in a rural area of Southern Illinois. And he really tried to make it to my college graduation. I was the first person in my family to really go away to college and have an official graduation, and that was a big deal. All of my mother, my aunts and uncles ended up with degrees at different points in their life, but they didn't take the straight path. Of course, my path wasn't 100% straight because of a potentially life-threatening illness, but we'll go over that a different day. So relatively straight path that I had, and my grandfather, he actually died my junior year in December, and he had definitely tried to make it that far. But in his last days, one thing I promised him is that I'll be a cardiologist in a small town, Grandpa, and I will bring quality care to that area so that people don't have to go 3 hours to a decent cardiologist. And my life has taken a lot of winding roads, but it led to Carlsbad, New Mexico at some point. And this opportunity really gave me a chance to fulfill that wish and that promise that I made to my grandfather, which I've never forgotten. I never forgot the promise I made him during a lot of ups and downs and roadblocks either. A lot of people go straight through college, straight through medical school, straight through all their residency, and at least appearing from the outside, I'm not going to say on the inside with any of those people that they didn't face challenges. But as you get to know me and you realize some of the challenges that have been brought to me, and some I brought on myself. I'm also somebody that's big on accountability. Some roads that I took, I probably should have taken a different road and would have led me somewhere maybe faster. Although I believe in the journey, and I believe you get where you're supposed to be when you're supposed to get there, there are definitely a few steps I could have made a different decision. So life is definitely about decisions and accountability. You've got to say, what did I do to get myself in this situation, and what can I do to get myself out? So definitely there'll be some stories about me that I'll tell you, or that maybe you'll even hear from others. They're like, well, that's maybe not the best decision that she could have made at that point in her life. And that's definitely the truth. And I'm sure we all think that. We all look back on stuff and think, wow. But throughout a lot of ups and downs of decisions and, different college choices and different, a lot of different priorities came up in my life in different ways. I definitely maintained in my heart that becoming a cardiologist in a rural area was my true calling. This is not a job. This is not a career. This is a passion. This is a calling. I am called to help people in a rural area take care of their cardiovascular needs. I love prevention, which sometimes some people say, well, you're an interventional cardiologist and you're saying that you treat heart attack patients and you fix blockages, and I do. But I love prevention. If I could prevent all heart disease, I definitely would. And that is definitely something that drives my whole team, which you'll get to know a lot of the members of my team throughout this process, but I have an amazing team of staff. I had a patient yesterday who's well known in town, and her husband was a long-term physician here, and she's had a lot to do with the healthcare industry. And she said, Dr. Ryan, I just want to tell you that I've never been to a physician office where the staff made me feel any more comfortable than your staff do. And that's every single staff member. Of course, she pointed out my mother in particular and how amazing she was, and they have a nice bond of talking and chatting. She's participated in our cardiac rehab program, and often as part of doing that, walking on the treadmill, riding the bike, that kind of stuff, you get a chance to chat with some of the different staff members. And she has just enjoyed that thoroughly. And she's just said, I'm very impressed with your staff, and that means a lot to me. Again, sometimes I say, everyone's like, oh, Dr. Ryan this and, Dr. Ryan that, but I'm only as strong as the people around me. I've never been on this journey by myself, and I'm certainly not on it now alone. I have a great team. So shout out to them this morning. They're going to be excited to see this get going. Hopefully they're working on prior authorizations and stuff as I'm shooting this podcast. And we'll talk about that in healthcare issues too, things that frustrate us. So anyway, I started my practice in Florida, which was somewhat accidental but amazing. And I built a successful practice with 2 partners, and we had a very unique practice. We served a large region in Brevard County, Florida, and things happened in our personal lives that sometimes made a different choice better. So I decided that I would figure out a different option. So I started, and I'm here to keep it real, to be open and raw. I got a divorce from my first husband, and it was very traumatic. And after 18 years and being together since we were 18 years old, and that's not where you expect to be in your mid to late 30s. And it was difficult. My husband was part of the practice. We had, he had been supportive and there for me through a lot. And it's hard to be married to a physician. It truly is. Being the other half of somebody who is so committed, my number one priority is the patients and my passion, and that's true. And now learning to balance family with that is a huge challenge. But there has to be some people willing. I'm not going to say I'm like people in the military, like my nephew and my grandfather and my uncle, so many who have served, who I completely respect and admire. They are literally putting their life at risk. But it is similar in a sense of sometimes you have a passion, a career, a decision that really does sometimes outweigh the immediate needs of your family. And that's definitely true with healthcare. I think I spent several years on the journey, telling my ex-husband that it'll be better once I get where I'm going, and once I'm in control of my future and I'm not with attending doctors telling me where to go and what time to be and on their schedule and stuff, it'll be better. and it wasn't better. I worked from probably 6 a.m. to midnight, 7 days a week. I think on the weekend we probably worked 7 to 3 or 4. And we were on call almost 30 days out of 30, 31 out of 31 at 3 different hospitals there. And I loved it, but when you talk about pouring from an empty cup, like that was just, and even at some point, you know, they tell you not to do too many major life-changing things at the same time. Going through a divorce was very challenging, and I stayed in my practice probably about a year after that, and it's somewhere in that finding yourself, redefining who you are, you know, really figuring things out. I thought, I don't know if I can continue this pace, you know, until well into my 60s. You know, in your late 30s, working those kind of hours with that kind of commitment, it was just hard to see. I mean, burnout was becoming a little bit of a factor. Throughout my entire training, I had been the one to stay late on Friday night, to try to get the extra exposure, to go to the operating room with surgeons. I remember a night in Michigan, in Detroit, where I did some of my training as a medical student. An unfortunate woman came in with a 90-pound tumor in her abdomen, and they were taking her to the operating room. She had lost like 200 pounds. I mean, it was just, she was very rural, remote area, had not sought care. There was just a whole lot of complexities to it, but basically she had this 90-pound tumor, and they asked any of the medical students, do you want to stay late and help and do this operation? I mean, that was like a life, once in a lifetime opportunity as far as I was concerned. And I did assist, and in assisting literally the medical students, we were kind of holding this tumor in the abdomen once the surgeons got it totally open, and it would literally, we'd kind of roll to one side, and they would cut off the arteries to that tumor were about this size. And just seeing them suture those off, tie those off, realizing, if this bleeds, there's not going to be, the outcome is not going to be fixable because it's just such a large artery. And there were several very large arteries. Tumors can become very vascular. And so, but actually she did very well, ended up having a very successful recovery. I ended up getting to follow her in the clinic even. She did very well. But I always took those opportunities. As a medical student, especially that 3rd and 4th year, you're paying anywhere from $30,000 to $60,000 a year for your education, but you're really out on rotations, participating as part of the team. And I've had those medical students, sometimes that are like, oh, can I go? Or what time do I need to work till? And those sort of things. And I always felt like if I'm going to pay this kind of money and have this kind of commitment, I'm going to get as much out of it as I possibly can. So, okay, and we're back with the patient who did very well. And yes, I'm getting over a little bit of a cold. I'm feeling fine, but just a little bit of drainage and my throat's still scratchy, so I apologize for some of the interruptions. So anyway, I always took those opportunities, and I continued to take those opportunities. And when you start a practice, and I loved my partners, one of them was a Harvard-trained, well-educated, great skills, interventional cardiologist, was a good leader, taught people on the East Coast how to go through the wrist when we started doing heart caths more through the radial artery in the wrist versus the femoral artery in the groin, which had been the traditional way to do the procedure. And, it's not like we never said, let me work from 6 a.m. until midnight. It's just the larger net you cast, the more patients you treat, the more they tell their friends, the more you meet other referring physicians, just the busier you get, which, is what you want, but it can definitely get to a little bit of an overwhelming stage. So at any rate, really looking at, okay, I'm a little bit at a crossroads. I did help build this practice in Florida. We had our own outpatient cath lab. We were very successful. We had amazing staff. But I really felt like with my divorce, my husband at the time had been friends with my partners and their wives. And, sometimes you just really do I needed to redefine who I was. And so I looked for other opportunities. And I first started doing, whenever physicians work part-time work or they go travel, we often call it travel nursing and stuff. For physicians, we often call that locum tenens. So I took some different locum tenens positions. I've also covered hospice work, ICUs, I'm an internal medicine physician first, and then you do cardiology training, so I can cover all of those different areas. And I had, over the years, done a lot of work in different areas. I had worked in rural Maine some during my cardiology training in Philadelphia and Tampa. And while doing that, I just fell in love with the state of Maine, the people, the scenery, the rural nature, the way they had a rural system that was set up for healthcare, very strong. They had 2 to 3 major centers within the state, very effective flight transport to Portland and Boston, and I was very impressed with the overall nature, scenery of the state itself and the healthcare infrastructure. And so when I was at a particularly vulnerable period trying to figure out what I really wanted to do, I thought that doing some locum work up there would probably help me take some time to really figure out what I wanted to do. It's not an easy decision. I'm, again, a female interventional cardiologist. There are not a lot of me. Being employed by big corporations has its pros and cons. Being, the youngest female member of a 30, 40 person cardiology group, that's totally male dominated, has its own challenges. I also saw a lot of, there's politics involved in a lot of different areas of business. I think we all know that, particularly my exposure with healthcare. In these large cardiology practices, there was a lot of, which a large group trained me in Florida and did an amazing job, and I respect my training. There was just a lot of things that happened on an administrative standpoint, which were not things that I remember once when my lead attending physician, his father passed away, and he needed somebody to help round for him. And the other physicians were like, well, my name's not in the box, so I'm not doing the consults, And I remember being like, well, somebody's dad died, I think, your name in the, and, I understand people need to get their own boundaries. And again, they have personal lives, and trying to sort it all out is a struggle for all of us in healthcare. But I just didn't really want to be part of like a large conglomerate where, you couldn't, my partners and I would have never when we covered for each other at any time that we needed to, and I really wanted more of that kind of environment versus a large group. And the other thing is physicians, sometimes we're a little bit know-it-alls. So, we don't always have the business sense that we should have. I think older physicians that I've met, for the most part, had a lot of business knowledge. I used to be an ambassador at my medical school in Kansas City when the physicians would come back for homecoming. And I would ask them, you guys seem so diverse. They would know art. They would be involved in, owning homes. They would be, on board members of banks. They would just be so, have such diversity of thought and business interest. And I would just ask them, I feel overwhelmed trying to keep up with the science of medicine. How are you guys so diverse? And they're like, well, Amanda, I'm just going to be honest with you. When we went to medical school, there were 2 antibiotics. There were 2 medicines for blood pressure. They're like, as the science gets more complex and there's so much to learn there, unfortunately, some of the well-rounded nature and business side of things that were taught to physicians kind of went to the wayside, and we became very focused on science, which you need physicians that understand science and know it. There's also a certain amount of how long can you make the training period. It's already, again, my dad came to my last graduation, well, so he thought, then I went and got an MBA, but that was, we'll talk about that later. But at 35, he came to my last graduation. I think that was about the 5th or 6th, post-college graduation that he had been to of mine. I had an intern year, then I had residency, then I had a cardiology fellowship, and then I did an interventional cardiology fellowship, So there I was finally getting going at 35. He's like, when I dropped you off at kindergarten and you were 5, I did not think that I would still be going to your graduations at 35. And my sisters, they have sat through a million graduations. I have to do a quick aside on that. I have a habit of booking my flights out of Roswell here last minute. Either always a patient needs me with some emergency in the very last minute before I'm trying to catch a flight. And my sister after struggling a little bit as the youngest child and finding her own niche in life. And she had completed her nursing degree, and I was very excited for her, and I was going home for her graduation. But of course, a patient needed me at the very last minute, and I ended up I barely had time to catch my flight out of Roswell. Of course, it was the only option, and I was literally going to miss her graduation. And I was devastated about it, because I was like, this child has sat through 10 graduations of mine and been there for so many different things in my life that I cannot miss this. So I literally, I'm just going to be honest, I was driving, 100 miles an hour on 285 to get to Roswell, and I got pulled over by a friendly state policeman, and I just was very, I'm just going to keep it honest, sir. Yes, I'm speeding. Yes, I understand. I'm sorry. I do understand the risks, but I have got to be there for my sister, and this is my address, and you can mail me a ticket, and I will pay the ticket, and I will slow down a little bit, but I've got to make it to that graduation. And he, on that instance, let me go, and I made the flight, and I made it to the graduation. So that was, yeah, I'm not encouraging driving 100 miles an hour under any circumstances, but there are times in life where something means so much to you. And I just, sometimes I don't know why the stars always line up that way, that you have something to do before at this point in my life, I've accepted that all plans are temporary, that, they can change at any point, and I'm used to that. But there were just a few events in life, that you just really want to make sure you're there for. So I was definitely there for that. I'm proud of my sister. And my other sister, went to school to be an attorney, and she used to pass out at the sight of blood and didn't really want to follow the rest of us into healthcare. But she really had that nurturing want to be involved in healthcare. And so over the years, she did. And she also could not have children, ended up adopting a couple amazing little girls. And through that whole process, really became interested in studying OB and becoming an OB nurse. So she went back for a second bachelor's in nursing after being an attorney, and did OB for several years. And now she's on the risk management side of things with combining her law and OB nursing training. So that's really great too. So I have an amazing family full of, just to wrap up that, my mom and my aunts and uncles and all of their interest, and my grandparents in encouraging us to have opportunities. 14 out of 15 of my first cousins on my mom's side ended up with college degrees and, good jobs and quality individuals with a lot of different training and backgrounds. And definitely we owe that to the generation before us that encouraged us all the way. So thank you to my mom and dad, aunts and uncles, and my grandparents for sacrificing so much of their own futures. They could definitely have had different retirements if they had not paid for so many kids to go to college and so many different adventures that we had too. We had plenty of trips and fun things, and so yeah, it definitely takes a village to get your children where you need them to go, and I appreciate them for doing that. So back to how I got where I'm at. So then I went to Maine. I worked up there. I had some good friends. I enjoyed this outdoor scenery. I really tried to make good decisions about where I wanted to practice. And I knew at that point I definitely wanted, I thought I was in a rural area, by the way, in Florida. It was 45 minutes outside Orlando. I'm going to call that not a rural area after being in Carlsbad. We could have a helicopter landed and in a patient in the operating room at major centers in Orlando within 20 minutes. So that was definitely a different experience. It's a big deal. Even 10, 15 years ago, you had to have heart surgeons on site to do any cardiology work like we do. At some point, we realized that we've gotten heart catheterizations so safe, and that emergency heart attack patients need care so quickly that you really don't want to waste the time. We say time is muscle. We have 90 minutes to try to get an artery open, or the damage done to that person's heart, if they do survive, is not reversible. So with that being said, we realized we had to bring the care to our rural areas. We had to set up an infrastructure where we could help people. And in assessing whether I was going to come to Carlsbad or not, I'm jumping ahead just a little bit. But in the 6 months prior to me getting here, we did an evaluation. 4 patients died rolling into the cath lab in Lubbock. So, it doesn't matter how quality of physicians we have or resources, which we do have some very great resources in Lubbock, Albuquerque, El Paso, but if we can't get the patients there alive or with a fighting chance, then we can't change their outcome. And so that was a big motivator of how I ended up here. So during that time of being in Maine, then I worked in Kansas, I went to the Virgin Islands, so that was an eye-opener and a little bit of a predecessor of Carlsbad in the sense of when I needed certain equipment, it would be like, well, it'll be 2 days on, by boat to get out here. So, 2-3 days so sometimes you may do with not perfect equipment and learn to improvise a little bit, because if someone's having a heart attack and you don't have exactly what you need, but you don't have another outcome that isn't, flying the patient to either Puerto Rico or Miami, which takes hours, if not a day. There's storms sometimes that you can't get people out. I mean, you really do learn to do the best that you can with what you have. So after doing that, I came to Carlsbad, and I really I was on a 3-month assignment when I came out to interview, and that's what I was really thinking. And they were like, the assistant CEO and the physician recruiter were like, you really seem like you might be a great fit. This might be what you're looking for. I want you to come out here and really see the place and see if this is something you think you would want to do long term, not just do a short-term contract. And they had built, a beautiful cath lab and trained staff, and they just hadn't found the right physician to really take that program to the next level. And so I did, and my initial thought was, where am I? Okay, so I'm driving from Roswell, just like, wow. When you haven't spent a lot of time out west, I've primarily been in the East Coast and the Midwest, I was like, wow, it is a lot different out here. And I'm just so rural, I was like, wow, it's just really different. But I loved the people immediately. I liked the hospital staff that I met. I liked the patients that I met. I met a lot of different people in the town. I met a lot of people from the community. I spent a few days out here, and I just felt like this, I really got in touch with my roots, and I prayed and I thought about it for a long time. I'm going to say it did take me about 9 months to make the final decision to come. It was not a decision I made overnight. To come out here by yourself, far from family and support systems, is a difficult decision, So kind of made the decision to come out here and really get a program going from scratch. That they had cardiologists in the past. At one point, they did a little bit of interventional cardiology, putting stents in and stuff, but then that had kind of faded. Then they had a cardiologist that was doing some procedures, but very minimal. And then she had left, and really they had not had cardiologists in over a year and a half before I came out here. And I decided this would be a perfect opportunity to kind of build a program. So I'm going to refer to my slides here. And what do you really need to look at when you're going to build a program? So building a program from a cardiology standpoint, you really have to assess the overall physical, social, and mental health status of your population. Think about the disease prevention. Really study detecting, diagnosing, and the treatment of illness. The quality of retirement community, which I think is a big concern out here, avoiding preventable deaths, and what is the overall life expectancy. So you have to kind of assess your area and think, what do we have and what do we need? I'm a planner. I enjoy strategic planning. I enjoy being part of a system that develops and improves the infrastructure of healthcare and an entire community. So I didn't come here, again, not just for a job, not just for an opportunity, certainly not just for a paycheck. I came for the opportunity to build something different that was necessary in the community. My initial assessment was that it was very needed. And so then figuring out what exactly the needs were and how could me and my team, and who did I have on my team, and what else did I need to build in order to accomplish those things. Yeah, so again, our rural resident needs in particular, do they have the finances to pay for their health care? Can they get off work to go seek health care? And again, that means providing it more local is important to them, because time off work, time spent for gas, everybody cannot afford that. It was my initial assessment of the Carlsbad area that everyone was going to Lubbock to get their cardiology care. And the truth is, that was true. A lot of the higher end people were going either Albuquerque or Lubbock or some to El Paso to get their care. But there was a very large middle and lower socioeconomic class in Carlsbad that really was not receiving care at all because of either time or financial reasons, or just poor healthcare literacy. Again, and that's a factor. Can they understand the healthcare? Do they understand the providers? Do they have the means to reach and seek these services? Do they have a confidence in their ability to understand and communicate? We have many patients that Spanish is their primary language. Some of them cannot speak very little English. We have multiple bilingual people in our office, and I'm trying very hard to improve my medical Spanish so that I can better communicate with patients. I've gotten a little bit spoiled here because my staff are so good and I have so many bilingual staff. But I really that's a goal for me for this year, is to really work on my own medical Spanish communication skills as well. And do they trust and believe that the care is quality? That's the next thing. There are a lot of people that have I go to Lubbock because the care local is not sufficient for what I need. And so in a rural area, there's just uniqueness. So these are some things that need to be addressed when we're kind of looking at what do we have and what are our residents' needs. I made sure that I met with the mayor and the community leaders when I got out here too, so that I could really assess what was going on, what did they think the healthcare needs were, what could I improve on. You have to have your pulse on a problem and an area in order to be part of the solution. So that's what I really sought to do. What do we have in our area from a healthcare standpoint? We have, in Eddy County in particular, we have 2 acute care hospitals. We do have a cardiovascular program now. We have OBGYN services, we have surgeons, we have podiatrists, we do have an endocrinologist, we have pain management, orthopedics, neurology, and we have some mental health providers. But we have a lack of many specialists. And some of the specialists too, and this is a problem that I'm struggling with in my current practice, I think I left the hospital with about 2,000 patient panel, which I thought I was very busy, and I did know that maybe there were some patients that were holding back from giving us an opportunity to be their healthcare providers based on some preconceived ideas of the healthcare provided in Carlsbad. But in the last 2 years of Advanced Heart and Vascular Center of New Mexico going on our own and forming a cardiovascular practice, we now have over 9,000 patients. So trying to manage 9,000 patients effectively, again, it's difficult. Our phone system has been an issue at times. We've had to go to the push 1, push 2, leave a message, and that is the last thing I wanted to do. But there are times I don't have enough space and I couldn't employ enough people to always handle all of the phone calls. Artesia General had helped us with our phone system at our former practice. We rented from them. They said we got more calls than the hospital there in a day. So learning how to really manage all of those calls. Our endocrinologist is very good in Artesia, for example, and we have a neurologist here in town, but they may take 6 months to get into. And so that's just, that access to care is a challenge. We try to make ourselves available within 2 to 3 weeks to people, and even urgent if you're needed. But it is becoming somewhat common to wait 2 hours for your appointment in our office, which is frustrating to people too, and I understand that. So trying to figure out how to meet everyone's needs, but not, not make people wait excessive amounts of time for their visit is a challenge. And obviously, as a physician treating emergencies, you never know when I'm going to get called to an emergency. So it's kind of, I can't tell you over the years how many times I've been at an yearly OB appointment and the OB has to go deliver a baby. What are you going to do? You know what I mean? Like sometimes you just have to wait. That's how it works. So what are we missing again here in our area? Again, we need more primary care providers, dermatology, rheumatology, GI, just, a lot of different. Pulmonology we missed. I think we have a telehealth option for pulmonology, but that was definitely a big loss. We had Dr. Teray, who was amazing. Ear, nose, and throat, and really just further development of our cardiovascular service line as well. I definitely would like to add either a vascular surgeon or another interventional cardiologist to our practice at some point soon as well. What am I really trying to create with this Advanced Heart and Vascular Center of New Mexico? And again, our surgical center is called Advanced Ambulatory Surgery Center of Carlsbad, New Mexico, is a regional center of excellence. What I found sometimes in the healthcare, between Roswell, Hobbs, Carlsbad, I'll call it our kind of tri-county Southeast New Mexico region, maybe we have a cardiologist at any given time at all of the different, we have 2 or 3 in each of those regions, but we have 0 pulmonologists or 0 urologists. Sometimes we have, 8 surgeons, in the region, and then sometimes we have 2. So really trying to say maybe it's better to have Carlsbad be the regional center of cardiovascular excellence, where we really focus on treating every different cardiovascular need that we can. Now again, within our small community, I think there are some things like open heart surgery. I remain a believer that should be done in major tertiary referral centers. And so I think that's still something that needs to be sent out to either, again, Lubbock, Albuquerque, El Paso, or sometimes even Dallas or Houston, depending on the patient needs. So really trying to build a regional center of excellence is a goal. That really requires, a specialized approach. Trained staff, that is a major factor in developing a regional cardiovascular center of excellence. We really have to identify people that are from this region that have some background in healthcare and interest in healthcare, partner with our local community college, with other programs, and develop further skills in those students so that they can become healthcare providers for our region for the future. Because I've tried for many years, been in many leadership positions throughout the hospital systems and otherwise to recruit physicians, high-end nurses, high-end techs, and it is very difficult to recruit to our area. I think we have a much better opportunity in recruiting people from the region and really helping them achieve future goals so that they can help sustain that. I think, I'm from somewhere else, and there are several good physicians that are. So clearly we can recruit from outside, but there are a lot of factors, it's often the person, it's often their spouse, it's often their children. Do we have the infrastructure as a community to really support the families of providers and staff? I mean, the cost of living here is very high, and that's it's a decision for some people because, housing is expensive and living is expensive. So sometimes I think you think if you're coming to a rural area that your pay will probably be a little higher and your cost of living will probably be a little lower. And I think in our region, that's not really the case. And so I think that definitely kind of plays a factor. So I think that's an important thing to really building this regional center of excellence for cardiology. You have to take a service line approach. If you find I think when new staff even start with me, they find it interesting that I don't just do cardiology, quote unquote. I don't just focus on the heart. I'm focused on leg blockages, on veins, on arteries in the legs, on aneurysms, on carotid arteries, on, there's just, the whole cardiovascular system involves preventing heart attacks and strokes, again, cholesterol management, blood pressure management. It's not just focus on the heart attacks, that's the whole part of it. It's not like that. You really have to create a practice that, takes care of the patient from front, to back. And that also includes working well with other providers, considering people's kidney function. There are several medications that we can give patients that might affect their blood counts, could be a hematology issue that could affect their kidney function. It means working well with our nephrology colleagues. So it really requires an holistic approach to the patient's different health, different systems. It also involves identifying, when I say holistic, it really reminds me that we've got to consider the patient's needs from a social service standpoint. Some of our patients need care navigators. They really are not able to understand, get to all their different doctor's appointments. One good thing that's happened in healthcare in the last few years is that Medicare and the federal government have actually approved having care navigators sometimes as a reimbursable expense for a practice or hospital system. So that means, as they noted, particularly cancer was one of the diagnoses, new diagnosis of heart failure was one of them. Sometimes that's just so overwhelming to people. We try to set up 6 appointments for you and tell you need to see this doctor, you need to take this medicine, you need to do this. And for many of our patients, that's just overwhelming. Some patients do not have the family support, or their families are busy working. It's difficult to take the time off. So one goal of our practice is to train some of these care navigators so that they can really help connect the healthcare within our community. And again, who is the physician leader of this service line approach? Again, I'm Dr. Amanda Ryan. I have a diverse background in training at major academic institutions, including St. Louis University. I've trained in Metro Detroit. I've trained in large community hospitals in Clearwater and Largo, Florida. And I've also I've practiced in Daytona Beach, Melbourne, at Titusville, Florida. I was raised on the business side of healthcare with my mom, as I told you guys a little bit about. I'm a natural born leader. I was in the top 10% of my medical school class. I was intern and resident of the year at St. Louis University. I was a chief resident. I was a chief cardiology fellow. I've always been involved in committees in quality assurance and improvement projects. That I've always felt like that was necessary, and I wanted to be involved in that. I have a loyal group of qualified staff, many of whom are local and trained by me or someone that I trained. A small town rural upbringing that really allows me to understand the needs of our small community. I have a physician executive MBA from the University of Tennessee that I got in 2022, that I think my understanding of healthcare dollars was on a basic level very strong, but I didn't always know all the terminology or all of the different ratios that we were really looking at from a more chief financial officer standpoint. So that really allowed me to kind of widen my horizons on the financial side of understanding healthcare. So with all of that said, now to get to what was the point of Partners in Heart Health. Partners in Heart Health is a nonprofit 501 that was created in order to really help the whole, not just Advanced Heart and Vascular of New Mexico or my surgical center, but our entire region, to really help the cardiovascular needs of our patients in some innovative ways. We're really looking at fundraising for some remote care monitoring programs. One overwhelming factor in healthcare and meeting rural needs that is discussed at every meeting that we go to is that we have to get creative. We have to use telehealth. We have to use remote monitoring. We can't just, there are 300 specialists for 100,000 patients in an urban or suburban area. There are 30 specialists for 100,000 people in our rural areas. There's no way that 30, so it makes sense. An average cardiology panel has cardiologists in Houston average 1,500 to 2,000 patient panel. If I'm saying I have 9,000 registered patients, again, that's already 3 to 4 times, But 30 to 300 means you would have to be doing 10 times the amount of patients at an average. And you get to a 20,000 patient panel, you're not going to be able to take care of those patients in the same traditional sense that we're used to a cardiologist being able to care for their patients. So we're going to have to utilize some innovative ways of making that work. And so that is a big focus of our foundation. And another large focus is really bringing our staff and new staff, getting them trained again in different cardiovascular areas so that they can remain committed to this region and really advancing the healthcare long beyond how long any of us are individually here. So that kind of wraps up how we got where we are. There's a whole lot to say. It can't really be summed up in an hour. But I just want to welcome you to this podcast. I think it's going to provide a lot of unique perspective, interesting information, and I look forward to next week's session.